His wife suffered with a panic disorder, and so she was really in trouble and needed help. And he just thought, well, I'll just get scanned to support her. And when I looked at his 56-year-old brain, it looked terrible. It looked like he was 80 years old, and it was bad for an 80 years old. Surprised, I asked him what he was doing to hurt his brain, and he said, nothing. Really? How much do you drink? I mean, it's a common question. How much do you drink? Not very much. Now, as a psychiatrist, I've learned you have to then follow up that question. How much is not very much? You know, maybe 3 or 4 drinks a day. Every day? Yeah, every day. But it's never a problem. I never get drunk. I've never gotten into trouble with it. Now I could see he was starting to get nervous. Why do you drink every day, I asked. Well, since my daughter went off to college, I have this empty nest thing going on. And I spend time at a local pub just to be with my friends. It's sort of like the show Cheers. Well, you're poisoning yourself, I said with little tact. If you keep this up, pretty soon your brain's going to look a lot worse. And with that comes trouble with memory and everything else in your life. The man was shocked that his brain looked as bad as it did, and as we talked, I could see he was beginning to develop brain envy. After learning about his brain, he wanted a better one. And so I gave him a very specific program that included stopping alcohol. For him, no alcohol is okay because he's already dealing with a struggling brain. With physical exercise, mental exercise, he actually decided to pick up the piano, vitamins, and fish oil. 4 months later, he wrote me saying he felt like mentally he was 30 years younger. His energy was better, his memory was better, he felt smarter and more articulate, he did better at work, and he even started writing a book, which is something he had been thinking about for 5 years, but could never find the time or the motivation. You too can have a better brain. You can have a younger brain, because with a healthier brain comes a healthier life. And you can have a better brain even if you've not been very nice to your brain. In this last segment, I'm going to give you 5 prescriptions to make your brain great. We are going to talk about protecting your brain, feeding your brain, working your brain, exercising your brain, and preventing Alzheimer's disease. So let's start. Protecting your brain. Head injuries matter. They can ruin your whole life. So wear your seatbelt. Drive in safe vehicles. Wear helmets that fit. Golf is good. Tennis, terrific. Table tennis is the world's best sport, which we'll see. Head injuries matter. Protect your head. Avoid toxic substances. Alcohol, drugs, nicotine, too much caffeine, toxic fumes, and many medications, especially pain medicines and anti-anxiety medicines, are not very good for your brain. And make sure that you get enough sleep. Remember, less than 6 hours a night is associated with decreased blood flow to your brain. And anything that decreases blood flow to your brain prematurely ages your brain. You want to feed your brain right. I call this eat right to think right. You are what you eat. Literally. Your brain makes itself new every couple of months. A healthy diet is essential to healthy brain function. Now, the best brain diet is made up of lean protein, good carbohydrates. I call these complex carbohydrates that are also low glycemic. You probably heard the term low glycemic. That means carbohydrates that do not raise your blood sugar. So think green leafy vegetables or vegetables in general, and decrease bad fat, like trans fats. But not all fat. Did you know that 60% of the solid weight of your brain is fat? so that if somebody calls you a fathead, say thank you. So you need healthy fat in your diet, especially omega-3 fatty acids, because all the 100 billion brain cells that you have, their cell lining is made up of long-chain fatty acids. And you get them through fish, such as salmon and tuna, avocados, and walnuts. And water is also critical to your brain. Remember, the brain is 80% water. Anything that dehydrates you is bad for it. And you want to make sure that you're drinking plenty of water throughout the day. So what are some brain-healthy foods? I put together a list for you of 12 of my favorite. And the first one's avocados. Why? Because of the omega-3 fatty acids. But this does not mean you can have a ton of guacamole. Because avocados also are fairly calorie-dense, right? And obesity doubles your risk for Alzheimer's disease. Obesity is bad for you. Okay, but a little bit of avocado is great for you, as are blueberries. In fact, I call these brain berries because they're loaded with antioxidants and they have fiber. Broccoli, because it has folate, very important vitamin for your brain. Green tea. Now, decaffeinated green tea is better, but green tea is amazing because in it, it has a substance called theanine. And theanine helps you relax and helps you concentrate at the same time. So it's sort of like the perfect supplement. And people that drink green tea on a regular basis have a lower incidence of Alzheimer's disease. Oatmeal, because it helps balance your blood sugar. Oranges for vitamin C. Red bell peppers. Did you know red bell peppers have 3 times the level of vitamin C as green bell peppers? Salmon for omega-3 fatty acids and great protein. Spinach for the B vitamins and helps balance your system. Tuna, turkey, and walnuts. Did you know that walnuts have 3 times the level of omega-3 fatty acids as almonds? But this does not mean double fudge chocolate chip cookies with walnuts. I tell my patients, eat from the rainbow. What that means is put foods in your diet that have many different colors, because that naturally increases the amount of antioxidants in your body to help keep your body and your brain young. But eating from the rainbow does not mean Skittles. I also recommend to my patients that they take 100% multiple vitamin every day. Why? We don't have balanced diets. We have fast food diets. According to the American Medical Association, people should take multiple vitamins every day to help prevent chronic illnesses like cancer, heart disease, and dementia. Almost 80% of us do not eat at least 5 servings of fruits and vegetables a day. You know, that's the recommended dose. Likewise, I believe all of us should take a fish oil supplement every day. Why? One of the main ingredients in fish oil, as I've said, is omega-3 fatty acids, found to be low in depression, low in dementia, low in people who have attention deficit disorder, and low in people who try to kill themselves. Taking fish oil on a regular basis every day has been found to be good for your heart, good for your skin, good for your eyes, good for your joints, good for your hair. Obviously, I started late. And good for your brain. I think all of us, as a baseline, should take between 1 to 2 grams a day of high-quality fish oil. Of course, you should talk to your doctor. And if you're a vegetarian and you don't want to take fish oil, you can take flaxseed oil. Now, the next thing to do is work your brain. Why? Because new learning is essential to keeping your brain young. Whenever you learn something new, your brain actually makes a physical new connection. When you stop learning, your brain actually starts to disconnect itself. Now, for this strategy to be effective, you need to learn things that are new and different for you. So, for example, if you're a gourmet chef and you learn a new recipe. Well, that's not good for you. Why? Because you already know how to cook. That's like second nature or a piece of cake. But learning a language, or learning about a new country, or learning to play the piano can be just ever so helpful, and it doesn't take much time. 15 minutes a day. That's all it takes. Change your exercise, change your brain. Exercise is literally the fountain of youth. People who exercise on a regular basis have better cognitive abilities. They think better, their concentration's better, and their memory's better. Exercise boosts blood flow to the brain. Exercise also boosts growth factors in the brain that help you grow new neurons. What? I thought we were born with all the brain cells that we would ever have. Wrong! About 10 years ago, they discovered that the brain continues to make new neurons throughout life. How exciting is that? So you can actually encourage new brain cell growth just by exercising. Now, the best exercises for your brain are both aerobic, where you get your heart rate up, geez, that's boosting blood flow to your brain, and coordination exercises, right? So just being on the treadmill, there's not much coordination with that. That's not necessarily good for your brain. But something like dancing, especially where you're learning new steps, now that is great for your brain. Unless, of course, you're drinking while you're dancing. The next great brain exercise, and I'm not kidding, is table tennis. Because you have to get your eyes, your hands, and your feet all to work together at the same time while you're thinking about the spins on the ball. There's this fascinating study from Japan where they actually scan people before and after playing table tennis for 10 minutes. And what they found is their cerebellum worked better and their prefrontal cortex, remember that? The most human, thoughtful part of your brain, also worked better. Table tennis is great for your brain. So more table tennis, less football, and boxing. Do you think boxing is a good brain sport? Say bad brain sport. Come on, let's be thoughtful about this. All right, who among you wants to live to 85 or beyond? Okay, you want to pay attention now. Why? Because 50% of people who live to 85 will be diagnosed with Alzheimer's disease. Wow. Well, that means you need to pay attention, and you're at risk for Alzheimer's disease. If you have a family member that has it, if you have a personal history of a head injury, heart disease, a stroke, diabetes, cancer, ADD, or depression, you're at risk for Alzheimer's disease if you don't exercise twice a week. You're at risk for Alzheimer's disease if you do not engage in regular lifelong learning. And if you pay attention to me, I'm going to teach you how to prevent it. With these strategies that I'm going to talk about, you can delay the onset of Alzheimer's disease by 6 years or more. But you need to make these interventions part of your life now. So what I'm going to do now is I'm going to talk to you about each of the risk factors for Alzheimer's disease. Okay, so the first risk factor is genetics. You have it in your family, and there's certain genes that increase your risk for Alzheimer's disease. So if you have a genetic risk, how do you decrease that risk? Well, you can't get different parents. So what that means is you have to take prevention seriously, as early as possible. The next risk is a brain injury. If you've had a brain injury, you have a higher risk, especially if you have Alzheimer's disease in your family. Now, how do you prevent getting a brain injury? Wear your seatbelt. Drive a safe vehicle. Wear helmets that fit. Don't play with your brain. And if you had a head injury, know that you're at a higher risk and you have to take prevention seriously. If you drink too much alcohol, you now have a higher risk for Alzheimer's disease. How do you decrease or eliminate this risk? Stop drinking. This is not that hard. Drink less. If you have cardiovascular disease, including hypertension or high cholesterol levels, that increases your risk for Alzheimer's disease. How do you decrease that risk? It's diet and exercise. And if you have heart disease or vascular disease, don't play with it. Get it treated. Because when these things run away from you, you are so much more likely to be demented. If you exercise less than twice a week, you now have a higher risk for Alzheimer's disease. So how do you decrease that risk? Exercise more. If you drop out of school, or if you're in jobs that do not require lifelong learning, you have a higher risk. So how do you decrease that risk? Regular, lifelong learning. Always be enrolled in some sort of educational activity. If you have diabetes, that increases your risk. So how do you decrease the risk of diabetes? Diet and exercise. And if you have diabetes, you want to make sure it's tightly controlled. Otherwise, it's a blood vessel disease, and it causes disease in your brain. Smoking. Smoking's a nightmare for brain function. Now, interestingly, the early studies on smoking and Alzheimer's disease said smoking protected you from Alzheimer's disease. But when they actually looked at the data and they figured out how it protected you from Alzheimer's disease, do you know how it protects you from Alzheimer's disease? You're dead! Dead people don't get Alzheimer's disease. But when they corrected for the dead people, what they found is it increases your risk. Of course, because it's constricting blood flow to the brain and it's poisoning you. Untreated depression and untreated attention deficit disorder are risk factors for Alzheimer's disease. So how do you prevent that? Is you treat them. These are brain disorders. Cancer treatment, how unfair is that? You get cancer and you have to take chemotherapy, but as chemotherapy kills cancer cells, it also kills normal cells. So if you've had chemotherapy, you want to be on a brain healthy program as early as possible. Make sure you talk to your doctor. People who have sleep apnea, you know what that is? People who snore loudly, stop breathing multiple times at night, chronically tired during the day. Untreated sleep apnea doubles your risk for Alzheimer's disease. You should get it treated. If you get your nails done or you get your hair done too often, it increases your risk. You know, one of the occupations at the highest risk for Alzheimer's disease are cosmetologists, and I think it's because they're being poisoned. When you go get your nails done or you go get your hair done, make sure the place you go has great ventilation. The treatments we have for Alzheimer's disease work early, really early. They don't work late. So you want to know if you're vulnerable as early as possible. In one study from UCLA, it showed that 95% of people with Alzheimer's disease are not diagnosed until they're in the moderate to severe stages of this disorder. Putting your head in the sand and saying, no, no, it's just normal aging. It doesn't work, because if you let this thing get away from you, it will ravage your brain and ruin your life. Now, the brain imaging work we do shows that we can tell actually years before people have their first symptom. Now, that's when it's most effectively treated. But what's interesting is there's also a very simple smell identification test that also can test early, because the smell center in the brain is near the memory center in the brain. So if you have trouble with certain scents, like strawberry, pineapple, lemon, or natural gas, then you are at higher risk. So these are easy to test for on a yearly basis. Although I looked at the natural gas one and I went, if you have trouble smelling natural gas, you're probably not going to have Alzheimer's disease, because you're going to be dead in the explosion. As you can see, the exciting news is that there are many things you can do to prevent Alzheimer's disease and to keep your brain healthy starting now. It's not that hard, but you need to make these strategies part of everything you do as soon as possible. Brain health matters. Alzheimer's disease causes you to lose your mind. It's important to use your brain to prevent it. So now we come to the end. And my prayer for you is that it's really just the beginning of a new way to think about your brain and your life. Success starts with a healthy brain. Failure is often the result of a brain gone wrong. The good news is, no matter how bad you've been to your brain, it is really never too late to change your brain and change your life. May God bless you. I'm Dr. Daniel Amen.